the way that ethos shows up in my office about having a diversity of approaches to make sure that I'm meeting people where they are is also what gives me the ability to work with hypermobile patients. Again, because connective tissue disorders like Ehlers-Danlos, among a few others, are really prevalent among neuroqueer populations. That means that a lot of those typical chiropractic percussive forces that, like, if you go to TikTok or to YouTube and you just search for chiropractic adjustment, what you will see will be designed to be surprising, designed to elicit a shock response or possibly even a little bit of body horror response, like, oh God, no, which, like, you and I could have a separate 2-hour conversation about my thoughts and feelings about that trend. But some of those adjustments are fine, right? But none of those adjustments are fine for everybody.
Yes.
And so for hypermobile people, I don't generally use that kind of force. It's really dangerous. It's contraindicated. Literally in school, they taught us if you meet someone with Ehlers-Danlos, you can't adjust them. Well, that's not right. You just can't adjust them like
No.
that. You have to adjust them based on their connective tissue response. And therefore, it's not going to be a percussive. It's going to be, here, let's just move this gently and sway with it. I'm going to assume, kind of like when I'm adjusting a very late stage pregnant woman whose body has been flooded with progesterone and relaxin, and the relaxin is literally making all of the connective tissue softer. I don't need to slam on her pelvis. That's not polite. To nudge it, because it will move because the connective tissue is less rigid. And so by the same token, that's how you approach adjusting hypermobile patients as well, is assume that the connective tissue will give way without the need for a percussive force. It generally will. And so scar tissue remediation with a hypermobile patient is a little more like, we're going to seesaw back and forth real gently again and again and again and again. I'm going to put a little pressure and then we're going to let it go. And generally people get improved mobility, improved nervous system function.